My name is Barbara Trimble. I'm the founder of Extended Family, and Extended Family has been with us since about 2005. I wanted to share a little story with you. The other day, I heard the term senile, and I thought, boy, I haven't heard anyone use the term senile in a long time. And the way it happened is I have two old Labrador retrievers. They're almost 12 years old. They rarely bark, just quiet, sweet dogs. And all of a sudden, a few weeks ago at 4 a.m., they begin barking downstairs, just barking until someone comes down. And I said to my husband, I said, what do you think's going on? Why are they barking all of a sudden? And he said, I don't know, maybe they're senile. And I thought, senile? I'm like, I have not heard that term. And it reminded me of my great-grandmother, who had some odd behaviors, stayed in her bedroom, didn't really remember our names. And I remember my parents saying, yeah, Grandma is senile. And of course, back in the 1950s, the word senile was that catchphrase for anything having to do with growing older. And as I think back to her now, she probably had Alzheimer's disease, but we didn't know about it then. But today we know much more about Alzheimer's disease, and we're going to learn much more tonight. We know, unfortunately, there's no cure for Alzheimer's disease, no rebuilding parts of the brain that is lost. But that doesn't mean we are helpless in this moment in time. It means we have to take whatever steps we can to nurture our brains. As it turns out, the same things that we do to keep our bodies strong will also help our brains. So eating well, exercising, staying socially active, knowing early signs when something's wrong to get some help, those are all important in terms of nurturing our minds and our bodies. The caregivers and care providers here tonight must be the voice for the victims of this disease, because they do lose their voice and their ability to tell us what it is like. So our task is to nurture this most extraordinary organ as best we can, to remember those who can no longer remember, and to educate and advocate for those suffering from dementia-related diseases. So that's it. It's a tall order, but I think everyone here tonight is up for it. Attending important events like this tonight is a major step in making that happen. So once again, I thank you so much for taking the time to be with us tonight. Before I introduce our speaker, though, I'd like to thank Mary Boucher, who is where? Mary is... Mary is a geriatric case manager for Extended Family. Her specialty is dementia. She leads a few support groups and really is spending her time trying to figure out the best ways to help families deal with this disease. I'd also like to thank Bryn Shute, who is the Bryn. Thank you, Bryn. Bryn is the Senior Services Supervisor for the City of Portsmouth. Bryn's been busy regrouping the senior center, among other things. So really happy. The two of them really put their heads together to make this happen tonight. So appreciative of that. And so that brings me to our extraordinary speaker. So once again, City of Portsmouth and Extended Family, we're so pleased to have Dr. Jürgen Bludau with us tonight. And I'm going to tell you a little bit about him. I'm actually going to tell you a lot about him. So here we go. Dr. Bludau was born in Germany and educated in England. He received his medical degree from the Royal College of Surgeons in Ireland and completed his postgraduate studies in the USA. He is a board-certified, Harvard Fellowship-trained geriatrician and the Executive Medical Director of Geriatrics and Home Care of the Elliott Health Systems. Prior to his current position, he was the clinical chief and director of the Clinical Geriatric Services at the Brigham and Women's Hospital Division of Aging. Dr. Bludau is a member of the Scientific Advisory Board of the Gerontological Economic Research Organization in Switzerland. Dr. Bludau's interest has always been the primary and consultative care of dementia patients. As a board member of the Massachusetts-New Hampshire chapter of the Alzheimer's Association and the current co-chair of the Medical Scientific Advisory Board, he was instrumental in developing a webinar in association with the Massachusetts Medical Society on better recognition of dementia in primary care settings. In his current position at Elliott Health Systems, he has established an innovative multidisciplinary memory and mobility clinic to better serve primary care physicians and families in southern New Hampshire and northern Massachusetts. Dr. Bludau is also chair of the Diagnosis, Treatment, and Care Work Group of the Massachusetts Alzheimer's Disease and Related Disorders State Plan. In the past, Dr. Bludau was on the governor's appointed Florida Statewide Alzheimer's Disease Advisory Council. He's the author of Aging But Never Old and the co-author of Alzheimer's Disease in the series Biographies of Disease. Dr. Bludau resides in Boston, in the Boston area with his wife and their 3 children. Thank you, Dr. Bludau. Take care of it.